I would like to start with introduction to Pulse Clinic. Pulse Clinic is established in 2015 in Bangkok as a lifestyle clinic. And right now, as of November 2021, we have 12 branches across Southeast Asia and Hong Kong. We designed the services for people of our race, age, sex, gender, religion, national origin, sexual orientation, and or sexual preference. And our highlight is we provide the services discreet, personalized, non-stigmatizing, and high standard friendly services. Right now, the location, we have 4 branches in Bangkok, 1 branch in Phuket, 1 branch in Pattaya, Hong Kong, and in Singapore, 2 in Kuala Lumpur, and opening 1 in Manila. And our services would focus from online to offline services, one-stop service that cover sexual health, sexual medicine, sexology, andrology, HIV and STI prevention, testing, treatment, and medical refill, travel medicine and vaccination, mental health and chemsex support, wellness, and Chinese traditional medicine and acupuncture. In the last 2 years, Pulse clients during the COVID-19 pandemic, we have reduction of number of our patients by a lot. And if we look at each country, we will see that most of our patients are male and MSM, and we have some female patients. And in 2020, we have 115 transgender patients, while this year we have only 77 transgender patients in Thailand. While in Malaysia, 2020, we had 25 transgender patients, and this year we had 13 transgender patients. And in Hong Kong and Singapore, we do not have transgender patients. I would like to talk about the case scenario because during the last 2 years, normally we know that transgender people, many of them do sex work, and then in Bangkok and Pattaya and Phuket, there are a large number of them. And during high season, they would be in this city, and in low season in Thailand, they would travel abroad to do the sex work. Also, during the COVID pandemic, there's no tourists, and many of our transgender travel abroad. So I would like to start with case scenario number 1. The first case is 26 years old, versatile top Thai transgender sex worker. She's a regular visitor for PrEP, and she's taking PrEP as daily dose. She does regular checkup at Pulse Clinic Bangkok during low season and in Phuket during high season. During the COVID-19 pandemic, she went to one city in the Middle East and to work with her boyfriend in the Middle East. And in September 2021, she ran out of PrEP and she was not able to refill PrEP. And of course, she had intercourse with many local male clients. And her boyfriend found her a job at his boss company, but then the HIV testing before work needed to be done. So anyway, she tested positive for HIV, and then she was deported. So in October, she came back to Pulse Phuket, and we started the treatment for HIV. Physical examination also saw, I saw multiple group of vesicle that broke into ulcers, and I made diagnosis of herpes simplex treatment, herpes simplex, and provided herpes simplex treatment right away. So we will see that the key idea of this case is that somebody went to work in the Middle Eastern country and PrEP was not available, and when it ran out, you couldn't refill your PrEP, and when you don't have protection, you continue to have intercourse, and however, you might have intercourse with people who are HIV positive and not get tested or have high viral load, and here we have concern on human rights that normally HIV testing before work is not necessary. And I mean, HIV positive people can do work normally. And so I think this is what we have to keep in mind and change in every country in the world. So case scenario number 2. Number 2 is a 37 years old Southeast Asian transgender sex worker in Russia. She worked in Russia. She's been living with HIV for a couple of years and undetectable viral load on daily Biktarvy. 20th of October this year, she presented with mild dysuria and mild sore in anus area. She went to a private GP clinic in Moscow. The doctor performed physical examination and saw anal lesion and told the patient, I don't know what to do. And about the dysuria, the doctor suggested that she sees urologist for proper management. So basically she went to a clinic and nothing was done for her symptoms. And 3 days later, the patient decided to fly to Phuket Sandbox to see me because I'm her regular doctor. I did physical examination, and on her anus, I saw painless elevated border anal ulcer with no rectal lesion. In the urethra, I saw mild erythematous and clear mucus leaking from the urethra. I made diagnosis of anorectal primary syphilis and urethritis. Started the treatment right away and sent anorectal swab and urine PCR 12 STD multiplex to confirm diagnosis and look for other infections. And 6 days later, the PCR anal swab detected Treponema pallidum, which confirmed diagnosis of syphilis, and urine PCR multiplex detected multiple infections, which were Mycoplasma hominis and Ureaplasma, Urolyticum, and Parvum. So according to the latest CDC guideline for treatment, I started the treatment with doxycycline 100 milligram PO twice a day for 7 days, followed by moxifloxacin 400 milligram once a day for 7 days. And also, when I compare the test result from the last 12 months, which we didn't detect any infections, so I made confirmed the diagnosis of new infection and started treatment for this case. Third case scenario, 31 years old versatile bottom Asian transgender sex worker who works in Bangkok. 3 weeks prior to arrival, she presented with dysuria and with yellowish discharge. She went to an NGO clinic. Physical examination was not done. And because normally the clinic they focused on laboratory examination and research. And anyway, urine specimen was collected for urine PCR, gonorrhea, and chlamydia, only 2. And she was suggested to wait for the result and did not receive any treatment. 7 days later, urine PCR for gonorrhea and chlamydia detected no infection. So there was no treatment provided to the patient. Anyway, symptom persisted and physical examination again was not done at the second visit. She then had chemsex, oral and anal as a top with one partner because the test was negative. And 1 week after, she developed more pain and came to our clinic. Physical examination, we saw inflamed urethral meatus and yellowish discharge stain on her underwear, and I made diagnosis of urethritis and started treatment as standard with ceftriaxone and azithromycin, and informed the patient not to have any kind of sex with anyone until infections are clear. Anyway, 7 days later, we did the urine PCR detected Mycoplasma hominis and Ureaplasma Urolyticum. Fourth case scenario, 56 years old, European transgender sex worker in Bangkok on daily dose of PrEP. 7 days before arrival, she presented with painless elevated border genital ulcer. And she went to another private sexual health clinic. The doctor performed physical examination and the lesion was like this. The doctor diagnosed HPV wart or genital wart. Doctor suggested that she sees urologist for electroculture treatments. And 1st of November, patient came to the clinic and she started to feel mild pain on the sore on the ulcer at the shaft of penis. And here we made diagnosis of primary syphilis and treated with benzathine penicillin 2.4 million unit injection intramuscular, and also sent also swab PCR multiplex to confirm diagnosis. And also, as usual, we like to look for co-infections. And 5 days later, the swab PCR detected Treponema pallidum. So the take-home messages that I would like everyone to get is transgender people are among the most difficult to reach population. Transgender people need preventive health screenings and continuous prevention. Transgender people are at high risk for HIV and other STI infections. Human rights for transgender people need to be improved, such as work admission for HIV testing is not necessary. Transgender people are often reluctant to seek sexual health care because fear of discrimination or disrespect, discomfort with gender issue, lack of money or insurance, or not prioritizing health before, health before beauty, as we know that they would invest a lot of time, resources, money into plastic surgery, and might be because of lack of medical provider that they feel comfortable with. So high quality modern healthcare are necessary for transgender people, and medical providers should update their knowledges constantly and watch out for emerging STIs worldwide, because we know that a lot of STIs are transmitted from direct contact, such as HPV, syphilis, and um, there are other infections as well. So, and while a lot of clinics, they only test for gonorrhea and chlamydia, HIV and syphilis. So we seems like the test for other infections such as mycoplasma and ureaplasma are not done enough. So we have to watch out for these emerging STIs around the world. Thank you very much.